Hey guys, this is Group 7. In this video, we will discuss about HIV awareness.
What is HIV or definition of HIV? HIV or human immunodeficiency virus is a virus that attacks the human immune system, especially CD4 cells or T cells, which play an important role in protecting the body from infection. HIV weakens the body's ability to fight disease and infection, making infected individuals more susceptible to various diseases. If left untreated, HIV can progress to AIDS or acquired immunodeficiency syndrome, the final stage of HIV infection, characterized by a significant decrease in the number of CD4 cells and an increased risk of opportunistic infection or cancer. What causes HIV or how is HIV transmitted? HIV or human immunodeficiency virus is transmitted in several main ways. 1. Sexual intercourse. Transmission can occur through vaginal, anal, or oral sexual intercourse with someone infected with HIV without using condoms or pre-exposure prophylaxis or PrEP. 2. Blood exposure. Through transfusion of contaminated blood or blood products, sharing needles or other injection equipment, and through open wounds exposure to infected blood. 3. From mother to child. HIV-infected mothers can transmit the virus to their babies during pregnancy, childbirth, or through breastfeeding. 4. Organ and tissue transplantation. Through transplantation of organ or tissue contaminated with HIV. 5. Piercing and tattoo needles. Through the use of needles that are not sterile or contaminated with HIV. It is important to know that HIV is not transmitted through everyday contact such as hugging, shaking hands, using the same toilet, or sharing food and drinks. Preventing HIV transmission involves using condoms during sexual intercourse, not sharing needles, and undergoing regular HIV testing if you are at risk.
People who are vulnerable to HIV. HIV can attack anyone, including the elderly and children. No age group is immune to this virus. The following are several ways of transmitting HIV that can affect various age groups. First, sexual transmission. This is the most common mode of transmission among adults. Second, blood-borne transmission. Through contaminated blood transfusion, sharing strangers or non-sterile strangers. Third, mother-to-child transmission. An HIV-infected mother can transmit the virus to her child during pregnancy, childbirth, or through breastfeeding. Children and the elderly can become infected with HIV through transmission routes relevant to their situation, such as from mother to child or the use of non-sterile medical devices. Therefore, awareness and preventive measures are essential for all age groups.
The early symptoms of HIV can be different for each person. However, some common symptoms include fever, sore throat, skin rash, swollen lymph nodes, and excessive fatigue. It is important to remember that not everyone experiences symptoms in the early stage of HIV. HIV testing is the best way to find out a person's HIV status. HIV attack the immune system, especially CD4 cells, which are an important part of the human immune system. This makes the body vulnerable to infection and other diseases. Apart from that, HIV can also attack certain body organs such as the spleen, lymph nodes, brain, bone marrow, and nervous system.
To treat HIV, a combination of antiretroviral therapy or ART is typically used. This involves taking a combination of medications daily to suppress the virus, boost the immune system, and prevent the progression of HIV to AIDS. It's essential to adhere the prescribed treatment regimen and attend regular medical checkups. Additionally, practicing safe sex and avoiding sharing needles can help prevent the spread of HIV. In addition to antiretroviral therapy or ART, supportive treatments such as counseling, mental health support, and lifestyle change are important for managing HIV. This can include maintaining a healthy diet, regular exercise, avoiding alcohol and drugs, and managing stress. It's also crucial to educate oneself about HIV and engage in community support networks for emotional and social support. We need to be aware of the danger of HIV because it is a serious and potentially life-threatening condition that can have significant impact on individuals, families, and communities. Understanding HIV helps us to take preventive measures such as practicing safe sex and avoiding sharing needles to reduce the risk of transmission. Additionally, being aware of HIV encourages testing and early diagnosis, which is crucial for accessing timely treatment and care to manage the virus effectively. Furthermore, raising awareness about HIV helps combat stigma and discrimination associated with the virus, promoting inclusivity and support for those living with HIV. By understanding the importance of HIV prevention and treatment, individuals can make informed decisions to protect themselves and others, ultimately contributing to the global effort to control and eradicate the HIV or AIDS epidemic.
After listening to several previous explanations regarding HIV disease, there are several steps that can be taken to build public awareness from the start. Things that need to be done include sexual education for the community and organizing education programs to inform about the dangers of HIV through posters, videos, and discussion sessions to convey this information to students and the general public. To avoid the dangers of HIV, the main thing that needs to be considered is awareness everyone regarding the use of condoms during sexual intercourse. This will prevent HIV transmission. Using condoms will be effective in preventing the transmission of HIV. Based on what had been explained previously regarding the initial symptoms and characteristics of people infected with HIV, what needs to be done is an HIV test. Carrying out an HIV test can reduce the risk of the disease getting worse. When carrying out this test, we can find it at community health centers or at community events that provide education for those who are detected positive. Some people contract HIV not only through sexual intercourse, but can also be caused by needles, syringes or needles in making tattoos. Therefore, the most important things to pay attention to is checking the cleanliness of the syringes or needles used when making tattoos to avoid dangers, infections, HIV. If someone is infected with HIV, one of the treatments that can be applied is antiretroviral treatment. This treatment can help reduce the risk of HIV transmissions. On average, some children contract HIV through their mothers, so it is mandatory for the pregnant women to have their health checked by a special service for pregnant women that has the following characteristics. Characteristics of the contracting HIV. In this special service, pregnant women will undergo antiretroviral therapy during pregnancy and breastfeeding to prevent transmissions of HIV to their babies. From the previous explanations, it can be concluded that HIV or human immunodeficiency virus, is a virus that attacks the body immune system, especially CD4 cells, making the body susceptible to infections and disease. Transmissions occur through contact with infected body fluid such as blood, semen, vaginal fluids, and the breast milk. This virus can spread through unprotected sexual intercourse, sharing needles, and from mothers to child during pregnancy, childbirth, and breastfeeding. HIV treatment can be done with antiretroviral drugs to control the virus, maintain the health of sufferers, and prevent further transmission. Awareness of the dangers of HIV is very important for all of us. Therefore, let us work together to prevent HIV transmission, reduce stigma, and ensure infected people receive appropriate treatment.
So that is our discussion about HIV awareness. We hope it will help you guys for more aware about this disease. Let's be more aware about HIV. Stay healthy and thanks for watching.